Hello, everyone. My name is Wendy Myers. Thank you so much for joining me on today's Facebook Live. We are going to be talking today about arsenic toxicity and sources of arsenic toxicity and how you're exposed to it. We're going to be talking about symptoms of arsenic toxicity, how to identify the presence of arsenic in your body, and supplements that detox arsenic, so you can detox some arsenic at home. And we'll also be talking about my Mitochondria Detox product. It's a new program that I've developed that is amazing at detoxing arsenic and other mitochondrial poisons that are very, very toxic to the body and toxic to our energy production. So thank you so much for tuning in. I do this Facebook Live every Tuesday at 5 p.m. Pacific, 8 p.m. Eastern, and I'm here to answer all of your questions today about anything related to detox, related to mitochondria, to detoxification, detox protocols, detox testing, detox supplements, whatever questions that you have, please throw them at me. I'm here at your disposal to answer all of your questions. So let's get started right away. Hi, Maria. Thank you so much for joining us today. I'm really excited to be here. I'm in a fantastic mood today. I have tons of energy. I've been very faithfully following my detox program, the Myers Detox Protocol, and doing lots of exercise in the sun. And I've just been feeling really, really good lately. And so I'm happy to be here and share with you guys and talk to you about detox. So hi, Blaze. Thanks so much for joining us. You joining me every single week. I really appreciate it. And Michelin, thank you so much. Marlene, thanks for joining us. Hi, guys. How are you? So let's talk a little bit about arsenic toxicity. So arsenic is very, very common. I do find the majority of my clients do test, do have arsenic in their bodies. So where do you get arsenic? So you get arsenic in conventionally raised poultry and eggs. And arsenic it's an antibiotic. It's used in an antibiotic that's fed to conventionally raised poultry and their eggs. And so if you're eating poultry or chicken eggs that are not organic, that are not grass-fed or pastured, they're going to have arsenic in it. This is a thing around the world. It's a practice around the world where chicken farmers and poultry, turkey farmers use this antibiotic that contains arsenic, and it makes the meat really pink. It makes it look really healthy. It makes the chickens grow 50% faster. So chicken farmers are paid by the weight of their birds. So if their birds grow 50% faster, they make 50% more income. So it's just going to be in all the eggs that are conventionally raised. It's an antibiotic that's put in the commercial chicken feed more accurately. Arsenic's also found in beer, and some beers, not all of them, in treated wood. So there's some playgrounds or decks that they use arsenic to treat the woods to prevent termites from ruining the wood. Arsenic is also found in coal combustion, so it can be in the air that we're breathing. Drinking water contaminations, very, very common. Arsenic can be found in the water of Argentina, in Chile, in Mexico, in the US, China, Bangladesh, and in India. Bangladesh, this is a huge, huge problem. There's so many people that are arsenic toxic because of the high levels of arsenic in the water there. Arsenic can also be found in pesticides, fungicides, and insecticides, so non-organic foods. Arsenic is also found in a lot of wine. So if you're drinking wines, arsenic can be used in the pesticides that are used on the grapes. Arsenic can be found in glass and mirror manufacturing, in paints and pigments, in tobacco smoke. So definitely going to be arsenic toxic if you've ever smoked at any point in your life. Table salt can contain arsenic as well. Rice and rice products. So I recommend that people do not eat brown rice. I recommend that people eat white rice because the arsenic is found primarily in the bran, so the exosperm of rice. So that's where all the toxins are going to be stored. So I prefer that people just eat white rice, and I think it's more pleasurable to eat white rice anyways. And organic rice has much less arsenic, but it can still contain arsenic because, say for instance, the soil grown in the southern United States, there were a lot of pesticides that contained arsenic used in the soils there. So soils grown on that soil, or rice rather, grown in that soil, even if it's organic rice, can still uptake arsenic from the soil. Because remember, organic foods just don't contain chemicals. They're not using pesticides. They still can contain heavy metals. So you're not safe just because from heavy metals just because a food is organic. So it has nothing to do with toxic metals. Cosmetics can also contain arsenic, and another big source of arsenic is seafood from coastal waters, especially shellfish like oysters and shrimp. The shellfish just harbor a lot of different metals, including cadmium and nickel and mercury. So the shellfish I generally tell people to avoid because they contain a lot of metals. And so let's talk about some of the symptoms of arsenic toxicity. There's a lot of different symptoms that people can present with when they have arsenic. Number one is resistant weight loss. This was certainly a factor for me because I did find myself when I was first starting my detoxification that I was very arsenic toxic. And also there's a compounded issue. If you're really mercury toxic, mercury poisons the enzymes that help to detox arsenic. So many times you have to get rid of the mercury before you can really fully detox all of your arsenic that you have in your body. And arsenic can cause resistant weight loss. So anyone that's having trouble losing weight, what arsenic does is it poisons enzymes that transports triglycerides out of your fat cells. So that it basically prevents your fat from being released from your fat cells. So I know there's a lot of women out there that are eating like chicken and broccoli every night. Or for me, I was eating El Pollo Loco for years and years, eating these conventional chickens, conventional eggs, thinking that I was eating healthy while I was really accumulating tons and tons of arsenic that later in life contributed to me having trouble losing weight. And I found this out after I had a baby, and I put on quite a number of pounds, and I was just killing myself trying to lose weight, going, what is going on here? I mean, albeit your metabolism naturally slows down after you have a child, you're kind of in hormonal chaos after you have a child. But I felt like it was much more than that, because after my child was 2 years old, I'm like, okay, this is not the mommy brain or hormonal issues or things of that nature. There's something else going on, and it was in fact the arsenic toxicity. Arsenic can also contribute to weight gain. It can cause fatigue. Arsenic's a very potent mitochondrial poison. So your mitochondria are the little powerhouses in your cells that make your body's energy, or your ATP. So if you have arsenic will poison enzymes that transport nutrients into your mitochondria. So it'll prevent the uptake or absorption of nutrients needed to make energy in your mitochondria. So even if you're taking mitochondrial supplements or nutrients that make ATP, it doesn't matter if the enzymes aren't working to transport those nutrients into your cells, into your mitochondria, to then produce energy. So it's very, very important if you have low energy levels, if you have chronic fatigue, that you need to detox arsenic to have your mitochondria fully functioning and fully capable of producing the energy that your body is able to. So the solution I've created that is a product called Mitochondria Detox. And it's a new program that I developed that you can find on store.myersdetox.com. I'll put a link to that in the comments here. And it's a really amazing way to detox arsenic over time. It's a very inexpensive, easy to follow program that I've developed so you can detox mitochondrial poisons like arsenic. Some other symptoms of arsenic toxicity are abdominal pain. A lot of people have random stomach pain and they don't know why, and arsenic can be a contributing factor. Eating disorders like anorexia and even bulimia can be a factor if you have arsenic toxicity. Brittle nails, mouth burning. So if you have burning in your mouth, esophagus, stomach, or bowels, that can be from arsenic toxicity. Cancers can definitely be caused by arsenic. Dermatitis, so skin rashes, chronic diarrhea, fatigue, edema, so swelling in any part of your body can be caused by arsenic. A garlicky odor to your breath or to your stool. can be arsenic as well. People can have thyroid issues and even goiter. They can have hair loss, headaches. They can have hyperpigmentation of their skin and their nails can be caused by arsenic. Increased risk of liver, lung, and skin cancers. Arsenic will interfere in the uptake of folic acid. So some people will have issues with folate or folic acid utilization and absorption if they have arsenic toxicity. People can also have sulfur issues. So people can have, arsenic will poison a lot of different enzymes and interfere in nutrient absorption and sulfur enzyme systems as well. People can have issues with hardening of the skin, like the palms and soles of the feet if they have too much arsenic. They can have kidney and liver damage. They can have mucus, like excess mucus production in the nose and the throat. They can have muscle aches and spasms, muscle weakness, nausea, nervousness. They can have respiratory tract infections that are chronic sore throats. They can have difficulty swallowing. They can have a sweet metallic taste in their mouth, throat constriction. They can have vertigo. They can have vitiligo and weakness as well. So a lot of different symptoms associated with arsenic toxicity. That's quite a list. But as you can see, if someone is going to their doctor with one or more of these symptoms, a lot of these can be contributed to so many different things. And so people aren't going to be thinking, oh, arsenic toxicity is a potential underlying root cause, which is why it's really, really important to get tested and to find out what metals that you have so you can get to another potential underlying root cause of some of your health issues and what is going on with you. So why don't we take some questions here before I go on. And so Raquel, hello from Florida. Thank you so much for joining us. And Susanna, hi from FV, Florida. Thank you for joining us as well. Susan Leahy, thank you. That's one of my closest friends that lives in Mexico right now. I love you. So Michael Blaze, thank you so much for joining us. And Donna, hi from San Francisco. So I have very high arsenic levels after 6 months in Florida. So, a lot of times people can have arsenic in their water. Even if they're drinking filtered water, they can have arsenic in the water that they're showering in. Because remember, you absorb a gallon of water in a 10-minute shower. So you have to be kind of aware of that and, check your water that you're showering in, check your house water. We have a water metals test on the store.myersdetox.com. You can just put in a water test or a water metals test and it'll come up in the search and you can test your water and see if you have arsenic in it. And many times people are very, very surprised by what they find in their water. When I tested my water, I had uranium and I had antimony. And I was aware of the uranium because in California, there's just uranium in the water for various reasons. And I have also, when I test people, everyone has uranium. We'll do a Facebook Live on uranium later. Very, very important for people to know about that live in California in the Southwest United States. So Nan, same for basmati rice, white or brown. So yes, I talked about rice earlier and how arsenic is in rice. So it doesn't matter what type of rice, it's really more about where it's grown. So you generally want to avoid rices that are grown in India or China. They're going to be pretty contaminated because the soil in which they're grown contain a lot of different types of metals. So you always want to eat white rice. And a lot of people say, oh, well, brown rice, it's so much more nutritious. And yeah, it is more nutritious, but it's a grain. It's not really that much more nutritious. So you have to do kind of like a cost-benefit analysis where, yes, you're getting more nutrition, but you're also getting arsenic and other metals potentially in that bran. I don't think it's worth the cost of getting some of that extra nutrition in the brown rice. There's much more nutrient dense foods out there like vegetables, like meat, like glands and fruits, things of that nature. Much more nutrition to be had in those foods, much more nutritionally dense than brown rice. So I don't really look at whole grains as being super nutritionally dense. Yes, there's added nutrition, but it's not really worth the cost of what the rice is concerned, the extra metals. So Michelle, hi from Mississippi. Thanks for joining us. And so I have a few questions here. So Blaze, is arsenic stored in the body and where? So arsenic is stored in the body primarily in the skin. It can also be in the ligaments. Arsenic is going to be stored in the nails. So that's why it can cause brittle nails. It's going to be stored in the lungs, and it's also stored in the liver primarily. Arsenic also presents very well in the hair, it's very easy to see on a hair mineral analysis. So that's primarily where arsenic is stored. And I was actually going to get to that question because I have a whole chart that I use where I can see all of the heavy metals and exactly where they're stored in the bodies. So we know what organs are primarily affected by those metals based on where they're stored in the body. So the liver and the skin is primarily affected by arsenic. So Lee, I've been taking Pectosol C twice a day plus a sunlight and sauna. That's fantastic. Yeah, the Pectosol C is great. I have a new product called CitraCleanse, which is a modified citrus pectin that we use in the same way that I use on my new Mitochondria Detox program. That's great. You're using the Pectosol C because it's an amazing binder to absorb all different types of toxins and chemicals that are in our body and in our environment that we're exposed to every day. So Raquel, what could arsenic detox symptoms be for someone following a nutritional balancing program? So there's a lot of different detox symptoms with arsenic. Number one, let me look at my little chart here. Definitely you can have headaches, you can have rashes, you can have brain fog, you can have a lot of different symptoms. Everyone's a little bit different. People can have fevers, they can have hair loss when arsenic is coming out. They can have nausea is a common one. People can have sore throats where it feels like they're getting sick and they're having kind of a sore throat. That is common as well. But that's really probably those are the most common symptoms when people are detoxing arsenic that I can speak of. And also Deborah from Florida, first timer here. Thanks you so much for joining us. So how does arsenic cause hair loss? So I can't really explain it exactly in detail. It just has to do with arsenic poisoning enzymes that arsenic will poison various enzymes, and I can't really explain it exactly, but arsenic affects the skin in different ways. So it affects the skin health. It's stored in the skin, and hair loss is just a known side effect, especially if someone is very, very arsenic toxic. They will tend to have quite a bit of hair loss. But I can't really explain the mechanism. I don't think I've ever researched that in detail, so I apologize. Would love to see your chart of heavy metals and where they are stored. And so let's get back to, let's talk about some of the ways to detox arsenic. And so some of the best supplements to detox arsenic, the first one is my new activated silica. That is a special form of silica that will bind on to arsenic and remove it from the body. And it will help to mobilize arsenic from the skin and other tissues and from the liver. And then you want to take something like a binder like my CitraCleanse to bind onto it and take it out of the body through the urine, through the kidneys. And so the activated silica is probably one of the best products on the market to detox arsenic. There's other great products like DMSA. That's something you'll usually get at a doctor's office. There's people that are doing IV chelation. I don't recommend that, but I'm just saying DMSA is an amino acid. It's one product that will remove arsenic. Another amazing way is my CitraCleanse. It's a modified citrus pectin. That is an amazing way to detox arsenic. One of the most effective things you can take for arsenic. Also, sodium R-lipoic acid. That's not alpha lipoic acid. It's actually a different form. It's called sodium R-lipoic acid. It's a fat soluble lipoic acid, where alpha lipoic acid is water soluble. So this gets into your fat, into your nervous tissue, into your brain to remove arsenic. And so very, very important. When you get arsenic in your cranial cavity, and really important to remove that. And sodium R-lipoic acid is one of the best ways to do that, and that mechanism in the fat. Garlic is also great at removing arsenic, as is glutathione. So I only recommend liposomal glutathione, but you can also take precursors to glutathione like NAC, N-acetylcysteine. It just depends on what you tolerate. Some people don't tolerate NAC, but they'll tolerate glutathione. Some people don't tolerate glutathione, but they'll tolerate NAC. Just have to find out what works for you as an individual. And molybdenum is a mineral. It's called molybdenum is another way to pronounce it, or just Mo. I like Mo. It's a lot simpler. But molybdenum is a great way to facilitate detox of arsenic. And then we also have B2 or riboflavin that helps to detox arsenic. Very important when detoxing to take a B complex. I don't usually recommend people take individual B vitamins because they can compete with each other. So if you just take a ton of B2 or riboflavin, that's going to compete with the absorption and uptake of other B vitamins. So we don't want to have a competition here. It's better to take a B complex if you tolerate it. Some people have to take individual B vitamins based on what they tolerate. But for the majority of people, a B complex is best because that helps the liver detox and facilitates detox. Also, SAMe is also, it's known for relieving depression. It's something that people take to relieve depression, but it's also very good at detoxing arsenic. So if someone's really, really arsenic toxic, I would typically give them some SAMe, about 400 milligrams a day in individual blister packets. Works really, really well. Selenium, also fantastic at detoxing arsenic, as is taurine. Taurine is a sulfur-containing amino acid that facilitates the detox of arsenic as well. And if you're vegetarian or vegan, you're not getting any taurine whatsoever. So really, really important if you're a vegetarian or vegan to take 1,500 milligrams of taurine per day because there's just no dietary source for you. And that is going to impede your body's ability to detox, and it impedes your liver's ability to detox. And then vitamin E, also effective at detoxing arsenic. Not something that I typically recommend to people. It's just shown in the research to help facilitate the detox of arsenic. So let's answer some questions here. So a lot of questions here. So Lee, so I've been taking Pectosol C 2 times per day. I have a well that tests clean, eat whole organic foods. So do I need a hair test? I have fatigue, bloating, and brain fog. So I always recommend people to do a hair test or other metals test because it's good to know where you're at. What metals do you have? Some people are surprised by the metals that they have. I'm surprised. I have clients that will present with tungsten or beryllium or metals that are really uncommon that are definitely contributing to their major health issues, and they're just never going to find the underlying root cause unless they do testing and take targeted supplements to remove those metals, and also find out there are mineral deficiencies that they have so they can take those. Many people are surprised they're really deficient in selenium or zinc or magnesium, and they really need to find out and get to the root cause as to why and supplement accordingly. So it's a great way to have kind of like a sniper approach to supplementation and detoxification as a targeted approach, as opposed to a shotgun approach, which is just taking a multivitamin or a handful of things because you read an article about them. You really want to do more targeted supplementation, which I call the sniper approach. I think it's much more effective because we all are spending a lot of money and time on our health and a lot of time learning and reading and doing all this stuff. So you want to make sure that you're approaching your health in a way that's saving you time and money, so you're not wasting your time and money, which is very, very precious. So I always recommend that people do testing to find out what's going on with them, and I think that's just the best approach. So Marlene, are you familiar with UNDA products? My nutritional practitioner uses these and I can't find a lot of information on them. I honestly don't. I haven't heard of those before, so I apologize. So Micheline, does BioCell work to detox? Yes, so BioCell does work to detox arsenic as well. I should have mentioned that. But I'm recommending now my activated silica product. It's similar to BioCell. So that's the product that I recommend now for detoxing arsenic and other mitochondrial poisons. So Leslie, so what dose and form? So capsules or powder do you recommend for detoxing mercury, arsenic, and uranium? So unfortunately, I don't know what product you're referring to. So maybe just leave another comment with what product you want to know the dose and form of for the different metals that you recommended. So Jeanette, I take raw garlic every day. Good for you. So that's fantastic. Really, really important to take garlic if you tolerate it. So I love garlic, but I have a little bit of a sulfur sensitivity, so I can't eat a ton of garlic. But a little workaround that I do is when I do eat a lot of garlic, I take some molybdenum. I'll take about 500 micrograms, sometimes 1 milligram of molybdenum, because that's going to help your body to metabolize sulfur, to process the sulfur. For those of us that don't metabolize sulfur very well because of genetic issues or because of toxin-induced sulfur metabolism issues. Because what happens is when people get really, really toxic, their detox pathways start to break down and they have less ability to process sulfur or other foods or other toxins. So taking some molybdenum is a great workaround for those that may not tolerate sulfur-containing foods like garlic, onions, broccoli, cauliflower, cruciferous vegetables, egg yolks, things like that. So it pays to kind of pay attention to what you're eating, tune in to how your body feels, really try to get in touch with your body after you eat and get more sensitive and in tune, and especially after you eat sulfur-containing foods, because that'll give you a lot of information about how well your body is detoxing or not. And then you can take some molybdenum to help facilitate the processing of the sulfur. So Alicia, so what would arsenic skin symptoms look like? So dermatitis can take any form. I mean, it can be like a red rash on your skin, like bumps and things like that. When your body isn't, let's say your liver isn't detoxing very well, you can tend to detox toxins through your skin. Or if you're doing a lot of sauna, infrared sauna, and you can have arsenic coming out of your skin, it can cause rashes. So when you're detoxing, you don't want to get too worried about any rashes that are happening. I mean, they're normal. They're a normal part of detox. I've certainly had my share of rashes, but it's usually going to be kind of like red bumps, what it will look like. So Nan, so take a higher dose of B complex if you know you have arsenic poisoning. So you don't necessarily take a higher dose if B complex if you have arsenic. It's not about megadosing. It's more about slow and steady wins the race, and taking an amount. I think most people are deficient in various B vitamins, so I think everyone should be taking a B complex, preferably liposomal, because liposomal enhances absorption. When you absorb, you just absorb nutrients better when they're in a liposomal or a fat form. So look for liposomal on the label. I really like the Quicksilver B complex liposomal product that they have. It's fantastic. So you don't want to take a higher dose. You just follow the directions on the label of any product that you're taking, and that's enough typically. We don't take extra just because we're trying to detox. So Vicky, is BioCell the same as activated silica? Yes, they're very, very similar. The activated silica is the new product. It's in my Myers Detox line of supplements, and that's the product that I'm recommending. But yes, they are similar. They're a choline stabilized silica. So very, very similar. So Jeanette, so I just jumped onto this live broadcast. I'm curious, how does someone get arsenic poisoning? So the broadcast is going to be available after we're done with the Facebook Live. You can watch it again anytime on facebook.com/Myers Detox, and it'll be on my YouTube channel, youtube.com/Wendy Myers. So you can watch it again there. We went over the main causes of arsenic poisoning or arsenic toxicity already, but the main causes are conventional chicken, conventional eggs, rice, and cigarette smoke. So those are the main ways people become arsenic toxic. So and water as well, shower water and drinking water. So Jessica, so my arsenic level is 0.002. Would you consider that extremely high? And so I would not consider that extremely high. That's actually low. But a single test does not give you enough information because people release different metals at different times based on their energy level, their nutritional status, their body's improved ability to detox over time when they're attending to their health and they're doing a detox program or doing detox protocols. So many times people's first test won't have arsenic, but on subsequent tests, once they start doing a detox program, they can have arsenic continue to be released, or they'll have arsenic showing. And some people are surprised. They'll have a huge release of arsenic on a given test once they start doing a detox program. They can be surprised by that. And that's just the body releasing arsenic from storage sites and having it exit the body. And we see that evidenced on a hair mineral analysis. We see it in the urine. So how long would it take to detox that amount? I realize it's different from everyone. For everyone, is there a ballpark figure? So there isn't any ballpark figure with detox. Everyone's very, very different in how fast they detox and how dedicated they are to their detox program, in the quality of the supplements they're taking and their ability to absorb and utilize those supplements, because it doesn't matter what you supplement with, it only matters what you absorb. And I find many people aren't taking very good high quality supplements, or they're not taking them in a form that absorbs very well, or they're just not absorbing nutrients very well at all because of stress or leaky gut or intestinal infections or glyphosate toxicity, or a lot of the different issues that inhibit absorption for people. So a lot of different factors to consider when considering detox. But generally, if you're following a really good program, you're very dedicated, general ballpark figure can be a couple of years, 2 years, but it can be longer. Because one thing you have to remember with detox is a lifestyle. Yes, you want to follow a program for detoxification to be proactive and detox your metals. But detox is really more of a lifestyle because we're always exposed to toxins every day in our environment. We're breathing them in. Indoor air has 5 times the toxins as outdoor air, if you can believe that. We're just in our clothes, if you get them dry cleaned, or if you're using conventional products or you're spraying on perfume, there's so many different points of entry for toxins in our body. And you have to consider that every single day, even though you're detoxing, every day you're encountering and ingesting new toxins. And so you really want to be thinking about learning about some detox strategies like infrared saunas or coffee enemas, or targeted supplements like my Mitochondria Detox supplement program, and doing things on a daily basis to continue to maintain your clean, healthy body once you've done a more intensive detox program like my Myers Detox protocol, which begins with a hair mineral analysis. So there's no easy answer there. Everyone's different, but for me, what I try to teach people is detox is a lifestyle. It's not something that has like an endpoint, so to speak. So Deborah, do you recommend a lab for hair testing? Yes, I really like Trace Elements International, or TEI. As long as you're going to do a test and pay for it, you might as well test as many nutrients and heavy metals as you can. And I like Trace Elements because they test 37 different metals and minerals. So it gives me the most information as possible. So that's the lab that I personally use. And so Deborah, which testing do you recommend? I love hair mineral analysis. The Trace Elements International is a hair test, or a hair tissue mineral analysis. And that's my first line of defense. It's the first type of testing that I like to do with people. And then once I review that with someone and do a thorough health history, then I'll see if they're a candidate for a urine metals test. Not everyone's a candidate, because we use DMSA and glycine and some other things that might be a little bit too harsh for someone that's very, very ill. But anyone can do a stool metals test. Stool metals tests are great for seeing if someone has cadmium or silver toxicity. And so there's a lot of different tests that you can utilize because different tests show different metals. So different metals come out in different ways in the body. Some metals come out in the hair, some come out in the urine, some come out in the stool. So ideally, you want to do all three of those tests to get a full array, a full picture of the body burden that people have of heavy metals. But even then, it doesn't give the whole picture because what I find is when people do an initial test, their very first test that they do, some people don't have a lot of metals coming out because their body just isn't detoxing very well. They're really low in energy, or they're very, very sick, or they have multiple health issues, they're having trouble sleeping, or they have a number of problems going on where the energy they have is being used for higher priority things than detoxing. Detoxing is not a huge priority to the body when you need to digest and sleep and do other things. So when people are fatigued and they're not healthy otherwise, they typically have trouble detoxing. Big surprise. So what we do with the Meyer Detox protocol, use a lot of different methods to increase people's energy levels so that their body starts working better, generally starts detoxing better. And then on subsequent tests, people will see more and more metals coming out in their hair, in their urine, in their stool, once their body has the nutrients and they're doing the protocols, they're eating a better diet, and the body is getting the substances that it needs to detox. And so then on future tests, we start seeing more and more and more metals coming out. So Amanda, what else does silica detox besides arsenic? So my activated silica is great at detoxing a lot of different metals. So the activated silica, which is part of my Mitochondria Detox protocol or program, will detox aluminum, it detoxes antimony, arsenic, it detoxes bismuth, what you get in bare minerals makeup. So definitely avoid bare minerals makeup. My clients that use that, I always know right away because their bismuth is just skyrocketing off the charts. So the activated silica will detox that. Cesium, it will detox cesium. Activated silica will detox thallium, which is something that's in petroleum deposits, which then gets into the air from, petroleum burning cars, from, the auto exhaust from cars and trucks and things. So thallium is in all of our air, a big contributing factor to fatigue and chronic fatigue. Activated silica will also detox tin. A lot of people have tin toxicity for various reasons. And these are all potent mitochondrial poisons, which, reduce your energy levels and your body's ability to produce energy. So the activated silica is great for detoxing all of those metals. So, Susan, so how do you spell the supplement you mentioned if you have sulfur sensitivities? So I'll leave the comment here. I will write, it's called molybdenum. So another way to spell it is it's molybdenum. So it's molybedum, molybdenum. Wait, okay, I'm not getting this right here. molybdenum. So I just left that in the comments. A little confusing. So yeah, I understand people have trouble spelling it, including myself. So the phonetic pronunciation is molybdenum. So Mario, so I heard intravenous megadoses of vitamin C really works to detox from heavy metals. So yes, it does. But that can also have side effects as well. So for many people, they do any kind of treatment, they're considering any kind of treatment, they have to consider the cost-benefit analysis. So for many people, if they have cancer or they have a serious infection, megadosing of IV vitamin C is probably a really, really good idea. But because there are so many different ways to detox from heavy metals, I don't necessarily recommend that for detoxification of metals. It just, every situation is different, but vitamin C can drastically reduce copper in the body. So people who are copper deficient, that can be really devastating to them and can cause a lot of other side effects and problems in the body. So I don't generally recommend that unless there's a really serious reason why you want to do the IV vitamin C. It's one thing if your copper levels are fine, or if they're really high, that can be great to bring down copper levels if you're very, very copper toxic. But it can really devastate copper levels in the body. So that's why I generally don't recommend it. But some liposomal vitamin C is fine. That's perfectly fine. The megadose IV vitamin C, that's a completely different story. So let's see. So Belle, so is it safe to detox the fatty liver? Yes, it's actually essential to detox the fatty liver. Anyone with fatty liver, I recommend doing a coffee enemas. Those are amazing way to clear fatty liver. Really, really important if you have fatty liver, but also just giving your liver lots of love. I love perfect pressed milk thistle oil. That's great as well. And so a lot of different things you can do for fatty liver. I have a great article on my site called The Truth About Liver Cleanses that you can check out. That gives you a lot of good tips on loving your liver. So Sarah May, thank you so much for joining me. I love you and see you on Facebook all the time. So Randall, so I'm a new user of your Mito Detox program. Can you relate the best schedule to do it in the morning or before bed or with other vitamins and protein powders? So with the Pectisol C, I generally take it in the morning with coffee. So I'll put it in my coffee and I prefer to do it in the morning, but you can really do it at any time. So you can put the powder in your coffee. You can take it in between a meal. You can do it right before bed. But the key is you want to take it an hour away from other supplements, an hour away from medications, from food, because it can absorb other supplements that you're taking. So we don't want that. We want it to absorb toxins. So I recommend taking it an hour between meals and before supplements. And so there's also directions when you buy the Mitochondria Detox. It comes with directions on how to take it, very, very specific directions, do's and don'ts. So that wasn't available before, but it is available now. And if you email support@myersdetox.com, if you ordered or purchased the Mitochondria Detox prior to the directions being available in the store, they will happily email you a one-page copy of all the directions and do's and don'ts and things like that. So Deborah, thanks very much. I'm studying trichology, therefore this is very useful information. So Leslie, I live in Santa Barbara after the big fire and mudslides, and there's still a lot of residue of ash and toxic dirt and dust in the environment. What kind of heavy metals are usually left over in ash after a big fire and then in the mudslides after the fire? So there's going to be a lot of different toxins related to fires, burning arsenic-treated woods, burning paints, burning, tar that's used to make roofs. And there's a lot of different, there can be, all different types of toxins that are in homes that then burn. So you're right to be concerned about that. I really recommend, if you're still living in that area, to get a fresh air surround system. It's an amazing air filter that actually, not only it's not a filter, it's a filterless filter. It actually sends out different technology that helps to kill all the bacteria in your environment, kill mold, and it totally cleanses the environment. It's unbelievable. And you can run it for a whole week straight. It will kill mold. It will kill the flu virus. It will kill MRSA. It's amazing. So it's called the Fresh Air. I actually just recorded a podcast about it. I've been using it for about 3 months, and I've been vetting it for about 3 months, and I love it. Absolutely love it. So that's what I recommend to try to clean up your environment if you're still living there. But as far as, it doesn't matter what environment you're in, I always recommend detoxing, especially if you've been exposed to that and been in that environment. You definitely want to think about a detox program, but you would in any event, even if you hadn't been exposed to that. So Marlene, so can you talk about the foot bath Detoxicell? So I'm not familiar with that product. There's a lot of different products on the market. I'm not familiar with all of them. I am a big fan of detox foot baths. There was just a recent study that was published. Um, Someone that was doing a study on glyphosate and using the detox foot baths and the ion cleanse by AMD foot bath brought down people's glyphosate levels, which is huge. They do a lot of studies with autistic children, autistic teenagers. So I know for a fact that the ion cleanse by AMD is a very reputable the foot bath, and they really work. I can't speak to other foot baths because I don't know about all of them and if they have studies behind them and what materials they're made of or if they're reliable. There's just a lot of different things you have to research about every single different product. So I'm not familiar with the Detoxacell. So Catherine, are the detox recommendations for metals applicable to detox of toxic chemicals like TCE, PCE, and benzene? So they're not all applicable. I mean, different substances remove different toxins, and there's not going to be studies on every single different toxin out there. But my product CitraCleanse is fantastic. The modified citrus pectin absorbs a lot of different types of metals and chemicals. And so I don't have a list of all the chemicals that it's shown to detox. I'm interviewing an amazing guy, Isaac Elias, who's an expert on modified citrus pectin. He's been researching modified citrus pectin for 23 years. I'm going to be doing a podcast next Tuesday with him. That'll be published at some point soon. But we're going to get down and dirty, get the lowdown on modified citrus pectin. But like I mentioned, my CitraCleanse is fantastic at absorbing a lot of different types of metals and chemicals. But I can't speak to those specific ones that you mentioned. Those probably would require some research. I haven't really focused a ton on chemicals in my research, but generally zeolites and modified citrus pectin, other types of binders are really good at detoxing chemicals, as are using infrared saunas to excrete chemicals as well. And so Michelle, so organic coffee enemas, that's what the Cancer Treatment Center of America recommended for detoxing your liver. Exactly. I love coffee enemas. I can't recommend them highly enough. I do at least 2 or 3 a week myself, and I have for years, and I don't feel right if I don't do them. I can't recommend them enough. A lot of people are a little squeamish about starting them, but once you start, you can't stop. I assure you. But the first 2 might be a little messy or a little bit not so glamorous. But after that, after you kind of get through the learning curve of it and associate how good you feel after you do them, people tend to want to keep going. So Bill, so can you drink coffee while detoxing? Yes, I drink coffee. There's some people that want to just go super clean and not have any type of caffeine or other types of supplement or things while they're detoxing. But I think for a lot of people, they're exhausted. A lot of people are really tired, especially if they're ill. And I'm all for crutches, so to speak, or drinking coffee or caffeine or green teas while you're in the process of detoxing, cleaning up your body, cleaning up mitochondrial poisons that are interfering in energy production. So I'm not one of those people that wants to strip away the crutches that people may need to function, to get through their day, to get to work and to wake up. And so I personally love coffee. I drink coffee every single day. So I might not be the person to ask about that, but if it's your personal choice to avoid coffee, I think that's an ideal situation, because caffeine, does have certain residual effects. Some people are very sensitive to caffeine. It can interfere in their sleep, which will interfere in their ability to detox. People have different sensitivities to caffeine. People have different ability to metabolize caffeine in their liver. So everyone's very different. But again, I think coffee has a lot of antioxidants. There's a lot of research that shows that it has a lot of benefits to it. Coffee can also have a lot of cadmium in it. That's part of the reason why you get that little kick. It's not just the caffeine. There's cadmium in it The cadmium content will depend upon the soil in which the coffee is grown. So a lot of different factors. I'm not like an all or nothing type person. There's always pros and cons to weigh with every decision that we make, every morsel of food we put in our body, every supplement that we take. So those all have to be weighed individually for each person. So since bare minerals is toxic, what can you use that is less toxic? So I have an article on my site called Wendy's Favorite Beauty Products, and I have a few makeup lines that are really, really nice. I like Zuzu. That's really nice when you get on Amazon. Lots of good recommendations on that blog post on myersdetox.com if you just search for Wendy's Favorite Beauty Products. So Shelly, do you have a website where we can get the vitamins that you are recommending? Yeah, so my website is myersdetox.com, and you can go to store.myersdetox.com. I'll put that in the show notes here in the comments, and that's where you can get my Mitochondria Detox and any of the products that I'm recommending that I'm talking about. You can get everything there at store.myersdetox.com. So Elizabeth, so what kind of detox to use in hardening of the arteries? So you're not going to do like a specific detox for that. I mean, maybe lots of lemon juice will help to clear out the arteries. Lots and lots of magnesium will help as well, get rid of calcifications and maybe promoting hardening of the arteries. But in general, you want to test, find out what metals you have. Cadmium is a big factor in hardening of the arteries. So to remove cadmium, you want to take zinc, you want to eat red meat, like lamb is a really good one. It's more lean than, say, the beef. But lamb has a lot of zinc in it that can help to displace and push cadmium out of the body. There's other substances that remove cadmium, like EDTA is very good at removing cadmium. But cadmium is going to be the main metal that contributes to hardening of the arteries. And that's what people get when they smoke cigarettes. That's why cigarettes contribute to hardening of the arteries, high blood pressure, and heart disease. It's specifically because that cadmium hardens the arteries. So that's going to be the biggest factor in that metal is what you need to detox. But again, you want to test. The best way to test for cadmium is a stool metals test. And again, you can get that at store.myersdetox.com. And so Belle, so would a coffee enema be troublesome for a person who has IBS? No, it's fine for people that have IBS. And in fact, it can help to relieve that, especially if it's IBS with constipation. If your IBS is being caused by, parasites or yeast or other types of issues related to infections, the coffee enemas are great because they change the pH in your colon. So people find they can release a lot of parasites and worms and things like that. So it can be great for people who have IBS. So what brand of organic coffee do you recommend for the enemas? I like S.A. Wilson coffee. That's really nice. The blonde coffee enema, the blonde coffees are specifically formulated for coffee enemas. They have more palmitic acid. They have higher caffeine levels, so they're better suited to make the coffee enemas more effective. If you don't have those, just any organic coffee is perfectly fine. So Deborah, can you do a live on coffee enemas? Yes, I can. I thought I read, can you do a live coffee enema? I thought maybe not today. But yeah, so I thought about doing a Facebook Live while doing a coffee enema just to really, get some attention there. But yes, I can do a Facebook Live on coffee enemas. I think that's a great subject, and maybe I'll do that one next week because there's a lot of questions about coffee enemas and how to do them, do's and don'ts, tips and tricks. So lots of information that I can contribute on that subject. So Susan, how do you spell the supplement you mentioned if you have sulfur sensitivities? So that one is molybdenum. I answered that earlier. And so if you guys don't have any more questions, that's going to be it for today's Facebook Live. Thank you so much for joining me today talking about arsenic toxicity. If you miss any part of the Facebook Live, you can just stay tuned to the Myers Detox Facebook page. The Facebook Live will load again. You can watch it at any time on the Facebook page. It just takes a minute for the video to process and then for it to be available permanently on the Facebook page. You'll also find it tomorrow or after on my YouTube channel on youtube.com/Wendy Myers. Again, thanks so much for joining us. Today we talked about arsenic toxicity, symptoms of arsenic toxicity, how you're exposed to it, how you test for it, and how you detox it, the best supplements to detox it. Thanks so much for joining me again. I do this Facebook Live every Tuesday at 5 p.m. Pacific, 8 p.m. Eastern. And again, thank you so much for joining me. I love having you guys every week, throwing all your questions at me and just joining in the fun. I love doing this. I love educating you guys. So thank you so much for giving me such a wonderful purpose in life, which is helping you guys get better. I'm so appreciative every day to wake up and be able to help you guys. So thank again for joining me, and I'll see you guys again next week.